Brightly clad mothers carrying babies strapped to their backs make their way to the center of Chancho village, where volunteer community health worker Qasim Jibral is setting up weighing scales for the monthly growth monitoring session. The activity underway is one of the pillars of the UNICEF-supported community-based nutrition program that was introduced by the government of Ethiopia in 2008 in drought-prone and food-insecure districts. The community-based nutrition program is designed to prevent malnutrition, which is an underlying factor in at least half of all under-5 deaths in the country. Adise Gazahen joins the group of women with her 3-month-old baby Beza and waits her turn. Last month, Beza weighed 4.4 kilograms, and Adise is keen to find out how much weight she has gained since her last visit. Qasim helps Adise remove baby Beza's clothing, and she places her into the modified sack used to weigh the babies. Together, they note the results. Beza is now a healthy 4.6 kilograms. They then sit down for their monthly one-on-one session. While breastfeeding is a common practice in Ethiopia, exclusive breastfeeding from birth, including feeding the colostrum, the nutritious and disease-fighting antibody-laden first milk that is released right after birth, has been considered unclean in many communities and is thus thrown away. Promoting exclusive breastfeeding from birth until 6 months and then up to 2 years or beyond with complementary feeding is a major strategy for the Ethiopian government's National Nutrition Strategy, implemented at the community level through the Community-Based Nutrition Program and the Health Extension Program.
Ega obatin bute boda ati ifte boda luisifti male akkuma ta'e isu sanitti ittin kannitu jechu sanumaafu lamaan sangaru waille ni obasan an jenne inkijubu waille obasu sanin agarre immo egan dalee ciise boda luisise jechu tura kadura sangaru abba tokko awani barnota kana inegalini yechaaf ittin fayyadamne jechu yaadasan eguman dalee ciise bodan luisise kangaru egan sadiyan kana egan takamma istatiyanto egan agwandalu akasumatti ittin fayyadame lamaan tanagaru waanin baradhee jiru jechaaf akasumattiin
Qasim and his fellow volunteer community health workers weigh each of the 27 children under 2 years of age who have come for growth monitoring and discuss the results with their mothers. The monthly growth monitoring sessions provide a timely measure of how children are faring, enabling immediate intervention if malnutrition is detected by referrals to outpatient therapeutic feeding programs. The government of Ethiopia, with the support of UNICEF, has extended the provision of outpatient therapeutic feeding programs for children with severe acute malnutrition without complications like fever to 8,800 health posts, up from nearly none in 2004. Using ready-to-use therapeutic foods, trained health extension workers can save the lives of children who are severely malnourished, a condition that can be deadly if untreated. The results of the Chancho growth monitoring session are mixed.
ورينا الرمزان خيسة
Early the next morning, the volunteer community health workers in Chancho village use megaphones to remind the farming community that they will be discussing the results of the growth monitoring session at the community conversation in the village center. Health extension workers Mershat Anna and Tigist Imabir present the growth monitoring chart with the previous day's results and then lead the discussion on challenges affecting children's nutrition.
በየወሩ የማህበረሰብ ፈቆርስ በጎ ሰራተኛ አለ እሱ ይመዝናል በሁለተኛው ቀን ደግሞ እንደዛው እንትን ያካሄዳል የማህበረሰብ ውይይት ያካሄዳል ከማህበረሰብ ውይይት ላይ የሚያገኙትን ጥቅም ህፃናቶች ብዙ የወረዱት ወደኛ ይልካሉ ነኝ የማህበረሰብ በጎ ፈቃደኛ ሰራተኞች ሌሎቹን እርሚያቸውና ሚዛናቸው የማይገናኘው ደግሞ እዛው ጋር ይመክሩና ቤት ውስጥ ያላቸውን ነገር ተጠቅመው ህፃናቶችን እንዲንከባከቡ ያደርጋሉ በየወሩ ይመዝናሉ ህፃናቶችን ከተመዘኑ በኋላ ህፃናቶች እንትን አለ የግሮዝ ሞኒተሪንግ ቻርት አለ እዛ ላይ ይለያል ስንት እንትን አለ ስንት አንደር ዌት አለ ስንት አንድ ሲቨር አንደር ዌት አለ ስንት ኖርማል አለ የሚለው ነገር እዛ ላይ ይለያሉ ከዛ ይሄን ነገር ከለዩ በኋላ የኮሚኒቲ እንትን ማፕም ያነሳሉ ከዛም በኋላ ሲሲ ላይ ይቀርባል ይሄ ነገር ሲሲ ላይ ሲቀርብ ህፃናቶቻችሁ እንትኖቹ ግማሾቹ እዚህ ውስጥ ናቸው የመዘኑትም ማለት ነው ይሄን ታል እዚህ ውስጥ አለ ይሄን ታል ኖርማል ነው ብለው ካብራሩ በኋላ ችግሩ ምን እንደሆነ ከህብረተሰቡ እንደገና እንትን ያደርጋሉ ይሰበስባሉ ችግሮቻቸውን ይደረድራሉ ወይ ጡት ማጥባት ላይ ችግር አለ ወይ ጥሎ መሄድ አለ በቀኑ ሙሉ ህፃን ላይ ነው የሚውሉት ወይን ደግሞ አለ ማብላትም ሊሆን ይችላል ከዛ ካነሱ ችግር ውስጥ አንዱን ይመርጥና እዛ ላይ እንወያያለን ማለት ነው ያወያያሉ ከዛ እዛም ያወያዩ ነገር ላይ የራሳችን ችግር ነው ከዚህ በኋላ ከዚህ ነገር ውስጥ ማውጣት የምንችለው ራሳችን ነን እስከዛሬም እዚህ ጉዳት ውስጥ የጨመርናቸው እኛው ነን ከዚህ በኋላ እኛው ነን የምናወጣቸው ብለው አንድ ሀሳብ ላይ ይደርሳሉ ማለት ነው አሁን ሲሲ አሁን ካያካየር ሲሲ ላይ የተወያዩት እኛ እናቶች ጥለን ብንሄድም አባቶች ዞር ብለው አያዋቸውም ልጆቻቸውን እና አባቶችንም አወያየናቸው አባቶችም ከዚህ በኋላ የኛ ኃላፊነትም አለበት እስከዛሬ ትክክል ነው ህፃን ላይ ነው የሚውሉት እኛም አንዴ ከወጣን አንመለስም ይብሉ አይብሉ ምናቀው ነገር የለም ያለውን ነገር ቤት ውስጥ ያለውን ነገር እናት ጥላ ብትሄድም ልጅ ላይ እየተመላለሰን እያየን ልጆች የማያብሉ ከሆነም እኛ ያበላን ኃላፊነታችንን እንወጣለን ብሏል አባቶች
Adise's husband Bebu has accompanied her to the community conversation.
Togo wandi ballan onne Maria wasara arkanne yo ati mana jirachu batte akada ilmo gudsan nyaata slicing godu fi kabsan aka gonuf kana ammo huji wal gargarat ilmos wal gargare nyaata ga qopheessine akkuma isin godsanitti qulqullinasiisine nyaata qopheessuufi kana nuti duraan ilmoo yoo isin jiraachuu baatte hintoynu harkaanis hintoynu nurra fincaanti nurratti albaati jenna kana wantoonni marii hawaasarraa harkanne daa'ima kana yoo isin jiraachuu baatte haala gaariidhaan akkuma isiisanitti yaanneefi nyaata qopheessuufi kana wanti bal'aan deengada irraa harkanne jechuudha.
Itti jira haala gaariin na gargaaru jira garuu yoonni nankar tokko deeme ilmaan kiyyeenninis bakka bu'ee bakka xiyyeessan ta'ee nyaata yoon qopheesseefi deemu kaayee ittiin deemaami itti kanna ni nyaachisaa tana garuu xiqqoodha waan nyaatan ga'ini jecha dhiiseen deemu hoggaan taa'u eegaan luusisee booda narraa fuudhaa yoo nyaata jiraanne na gurshaa bakka haala gaarii jira jechuudha.
Deeggarsiin amma dammanaati godhu yoonni amma isin dalagaa jiraachuu jiraatte yoo ilmoon harma lugguu feete waan isin silaa godhu jiraatte san irraa fuudheetiin akka harma san luusistu godha yoo horii dura qabu taate horii irraa dura qabu bishaan taatus niin fidaafi qoraan fattoisu taatus mukaan niin qoraanis niin barbaadaafi waan kana fakkaatan niin deeggara waan isin hojjechuu jirtan.
Deder district is one of the drought-prone and food-insecure districts in Ethiopia, which in 2008 was hard hit by the nutrition crisis brought on by drought, rising food prices, and the shortfall in emergency food supplies during the global food crisis of that year. The community-based nutrition program came to Deder a year later, and in villages like Chancho, where there were numerous cases of child malnutrition, the conditions of children have improved significantly. The rainy season started late in Deder this year, and while the mountainous district is covered by deceptive verdant green, the delayed harvest is impacting livelihoods. Through the community-based nutrition program, parents learn how best to use their available resources to provide nutritious meals for their children, and when malnutrition does take hold, it provides an early detection mechanism and fast-track to admission to therapeutic feeding programs that can save children's lives.
Tokkoffaan hanqina nyaataatiin fi dhukkuba ijoollee qabu hedduu dhukkubni qabri ijoollee jedhanii qabriin baatee hophu moggaasanii sharaan asirraa buqqeetuma ganda kaan ikkuta ollarraa ka'ee olla daba amma eegam isaanii kun ganda keessa dhufe sharaa dhiisii namni diifa fan qabe min jiru ijoolleen.
Child survival rates in Ethiopia have improved significantly over recent years, with improvements in child nutrition playing a major role. In 1990, more than 20% of children would not survive to reach their 5th birthday. By 2010, that number had been cut by half. Preventing malnutrition before it becomes severe and life-threatening is the cornerstone of the national nutrition strategy of the country. The community-based nutrition program, first rolled out in pilot districts in 2008 with UNICEF support, has now been adopted as a national strategy to achieve this at the rural village level, where approximately 85% of Ethiopians live. The impact of the UNICEF-supported community-based nutrition program is helping stave off the impact of the ongoing drought emergency.